Back in February, my husband and I were working in acute settings, and we noticed that our guidelines with our protective gear started to change. One day we were asked to wear a full gown, the next day we were told to wear a flimsy apron, and we were concerned that these changes in guidelines would mean that healthcare workers would be affected and healthcare workers would die. So we questioned the government and asked them, why were these guidelines being changed? Was it based on science or was it based on a supply? We wanted to protect our colleagues because the last thing we wanted to see was our colleagues in ITU and us treating them. So at the time when we filed for a judicial review, we asked the government to get back to us within 48 hours. We had a sense of urgency because we knew that if they got back to us in time, we could prevent more deaths of healthcare workers. Unfortunately, the government dithered and they delayed, and by the time they got back to us, over 200 healthcare workers had died. And so now we have filed for the High Court and we're just waiting back to see what their response is and where we can take it from here. At the time, I was pregnant and I was in my second trimester of my pregnancy, and driving into work every day, not knowing what I was exposing myself to or my unborn child to, was a very scary situation, not knowing if my colleagues would be the ones in an ITU bed the next day. And the fear that I had for myself and my unborn child was something I would have never imagined as an NHS doctor. And despite asking for answers, despite asking for assessments and changes in my working environment, I wasn't heard. And I knew that many other women were in my position as well. And it was the tragic death of Nurse Mary Adjupong in April that really hit home for me, because she died leaving a newborn and a 2-year-old son behind, and she had to give birth via emergency C-section. And that is what changed everything for me, because it seemed that one death was a tragedy, and then from there they just became statistics, and the line had to be drawn. I think the NHS has been affected by our government for many years. However, in this specific time, I feel that a government chose not to act with urgency, and they lacked the leadership that we expected from them. We wanted them to lead our country through this pandemic, and we knew that they had all the resources in terms of the information and the experts available to make sure that our NHS was protected, and in turn the British public were protected as well. But instead we're seeing a government who are lying to us and who are using delaying tactics and distraction tactics to get through this pandemic. Right now, our government needs to be held accountable, and they need to understand where they went wrong and what mistakes were done previously, because we are approaching what looks like a second wave, and we cannot see the same mistakes as we saw in the first wave. And it seems that our government are still refusing to understand what went wrong. We're still stuck here asking for a basic test and trace system that other countries have managed to pull off. So why are we behind, despite having all this time to prepare? I attended Mary Adjupong's funeral, and I saw the grief that had hit this family. And as I walked down, the only thing that was going through my head was this nurse had died in such a needless way, and it was due to the negligence of our government. Our government failed to prepare its NHS workers and key workers during this pandemic. Now I have my own baby, and knowing that she could have been in the same position as Mary's baby, I can't imagine what it's like for her family and all the other families who've lost their loved ones. And to know that the government are failing to acknowledge their mistakes and they're failing to contact these bereaved families is what makes everything much worse. And I hope our government are held accountable and understand that their actions have led to a grief that's hit this nation that we haven't seen in decades and years.